Hi, my name is Steve Kirshblum, and it's certainly a pleasure to be here with you today. In the field of spinal cord injury, we've been on a long and remarkable journey. After more than 35 years working both clinically and in research, I've had the privilege to witness some extraordinary changes over time. Today, I'd like to offer a personal reflection, a look back at where we've been, how much we've accomplished along the way. But just as importantly, I want to highlight that progress in this field is never the work of only a single person or a single center. It's the result of decades of effort across disciplines, driven by collaboration, perseverance, and always with patience at the center. There's a famous quote that says there'll be a cure for spinal cord injury in 10 years. This quote came from a respected spinal cord research foundation in 1988. That's when I was just about completing my training. Well, here we are many years later, still working hard to find treatments. I've had the privilege of working with people with spinal cord injuries, and I continue to still host evening events every 6 weeks about where patients and their families come and ask about research. And I suspect that the questions I hear are the same ones you hear at your institutions. What are the researchers working on now? Will I walk again? Is there any hope? Before I begin, I'd like to introduce you to Victor. I had the pleasure of admitting him more than 20 years ago to my rehabilitation center. I had the chance to examine him and talk to him about his prognosis, and he shared with me his concerns, his fears, and his dreams. He wanted to graduate high school, be the first in his family to go to college, get a job, and maybe someday even get married. And then he asked me, what's new in the field of spinal cord injury? We've heard that question many times. I think it is important that as we spend time in this conference and others talking about research, to recognize that when we talk about the dramatic changes from the past to the present to the future, the technology, some excitement as well as some challenges, that we keep in mind that it's not just about the overall field of spinal cord injury, but the people who may sustain or are living with spinal cord injury that we are currently involved with. From a historical perspective, recovery from a spinal cord injury had a poor prognosis. The famous quote from the ancient Egyptian papyrus that stated an ailment not to be treated. There was this feeling of no treatment and no hope. And this helpless and hopeless attitude remained unchanged for centuries. Even after World War I, in this country, life expectancy was only 1 year. But people have always been interested in hearing about research. When I started in practice, starting from the early 1990s, we've seen so many changes. Public awareness grew as a result of high-profile individuals, including football player that's here, Dennis Bird, and actor Christopher Reeve, who sustained spinal cord injuries. This was a fascinating time for the field of spinal cord injury, and for me as a young physician involved in a high-profile case. I remember when Christopher Reeve appeared in the Super Bowl commercial in 2000, walking across the stage thanks to computer-generated imagery. The response was outrage. Many of you may remember that. Critics said he was giving false hope, and I was asked, why are you enabling this fantasy? But Christopher Reeve was never just about selling fantasy. He was fueling urgency to support research. He used hope as his catalyst. And despite the fact that his dream was never fulfilled, his work has lived on beyond his untimely death in 2004, serving as a source of information, advocacy, hope, and inspiration for others. Since the 1990s, much has changed. Improved medical and surgical management on the field and in the hospital, rehabilitation interventions, technology, and tremendous research advances. While once known as a field of doom and gloom, now there's so much taking place. Understanding the cellular and molecular mechanisms determining axonal regeneration and developing hosts of treatments. When you look at the timeline, it's truly amazing what we've studied. what I've seen in terms of the publications on steroids and cytidine, formimipyridine, activated macrophages, hosts of stem cells, including neural stem cells, Schwann cells, olfactory cells, mesenchymal cells, oligodendrocyte precursor cells, starting with Geron, Asterias, and now Lineage picking up that great work, hypothermia. And just in the last few years, publications including the Riscus, Spring, Inspire, NISKI. That's a whole lot of acronyms. And as those of you involved in research are very familiar with these projects, work being done by great researchers across great centers in the United States and around the world. And just this year, recently, the results from Onward with Uplift and NerveGen releasing their results from the chronic spinal cord cohort. And we're waiting for the anti-RGMA trials from Mitsubishi and AbbVie and others. There's so many different types of modalities and treatments that are being looked at. And from the rehabilitation research, including over the years, things like activity-based therapies, electrical stimulation, like the Vocare system and the freehand system and systems that helped for standing and posture control, intermittent hypoxia, exoskeletons, tremendous interventions for chronic spinal cord injury. And of course, more recently, spinal stimulation work, including transcutaneous and epidural, case reports showing potential benefits in movement, blood pressure regulation, autonomic function, respiratory improvements and spasticity, and advances in brain-computer interfacing where work is now being done. These studies have been highlighted in the public domain, including 60 Minutes, People Magazine, and Good Morning America, raising considerable awareness. And even in the last few months, exciting new reports, including the potential for brain-spinal interface and brain decoding controlling spinal stimulation. We've moved from science fiction of the 1990s to real-world potential functional benefits. There are so many exciting trials ongoing and on the horizon. Last year at this very conference, the second annual SCI Investor Symposium, I heard some exciting new work and know this year that we'll hear even more. Let me say this clearly. We are living in a time that at the beginning of my career, I could only dream of. And not only in research, we've come a long way in medical care, improved function for level of injury because of new techniques and technology as well. Perhaps increased life expectancy, we can debate this, but certainly in terms of quality of life. And technology has played a major part of this. But it's even more than just that. It's dogmas that are currently being rethought, things that I learned as a trainee and I started teaching when I was an attending. But the spinal cord can't recover. We've now learned that you can have an injury and then gain progress over time. And that the early time post-injury is the only time that recovery can be expected. We now know from many studies that that is not the case. And while we have come such a long way in clinical care and in research, we can't overlook the fact that there are still significant challenges that our patients, their families and friends, and we as researchers and providers and advocates face. And these are some of them. Rehab is more than just technology. Limited access, which we'll talk about in a moment. This idea of medical necessity, almost everything has become a luxury item. Still some tourism, people going for treatments that are not yet proven. And I think also forgetting the importance of rehabilitation. Let me give you one example. Let's not look at all this data, but let me just focus on, since I came into practice in 1990, what's changed in terms of length of stay. Take a look at just complete tetraplegia. The acute hospitalization has changed from 26 days and is now 27 days between 2020 and 2024. But look at the same timeframes in rehabilitation hospital admissions. We've gone from 98 days to 52 days, almost a 50% decrease. And for incomplete tetraplegia, we've gone from 77 days to 42 days, with only a decrease of 2 to 3 days in the acute hospital. Now you tell me, is that enough time to develop bowel and bladder programs and routines, to learn transfers, to enroll people and initiate a research intervention if we want to see if it'll help in the subacute time period, to emotionally process trauma and adapt to paralysis and prepare people for return to home? The ramifications of the shortened rehabilitation length of stay includes challenges to meet timelines for home modifications, which includes much more than adding a ramp. Changes demand time, funds, planning. Many times, people returning home find themselves using the kitchen for washing up or needing to go to a hotel for bathing. And the decreased length of stay also affects training and teaching about spinal cord injury or missing medical complications that may occur, so that people end up back in the emergency room or back in the hospital soon after going home. It's hard to adapt physically and emotionally to the significant and overwhelming life changes caused by the injury. We've seen the medical model shift. It's about medical necessity. But what's more necessary than equipping someone to rebuild their life? Yes, this is really me, not the gray hair and the stoop posture that you may see if we were live. But that was me when I started. And no doubt things have changed over the years since I started. In the late 1980s and early 1990s, there were no cell phones, certainly not smartphones. Zoom was a Saturday morning TV show, not a workday lifestyle that we've all become accustomed to. Social media didn't exist, and when you wanted to talk to someone, there was no email or text. You just called them on the phone that was connected to a wall, or you met with them in person. But while the world around us and research and technology has dramatically changed, the importance of rehabilitation, along with research endeavors, has not. We still need to be present, to listen deeply, nurture resilience, build trust, collaborate, and be with people on the most difficult journey of their lives. I look forward to hearing all of the latest that the tremendous scientists and researchers have to offer at this conference and others. Let's continue to push the boundaries. Let's innovate. Let's publish and debate, healthy debate. But let's also remember that behind every grant, every trial, every paper, there's a person hoping to be home and be independent as possible. Recall that what people with spinal cord injury have told us, it's not only about the cure, it's the research that we can do to help people get back to work, children to raise, potentials to realize, and live their lives. So what about Victor? I continue to see him. He graduated high school, was the first in his family to go to college, got a job. This was his wedding, his first and his second child. And I continue to see him, and he continues to ask me, what's new? And I'm thrilled to update him because there are many steps forward that many of you have been involved with. And certainly since I started the conversation with him more than 20 years ago. Rehabilitation is the unfinished business. This is a quote from the person who founded my institution that I work at. It's more than rebuilding of shattered lives. It's the fierce belief in our individual responsibility. Rehabilitation comes from the Latin. It means to make able, to help patients remain healthy and strong physically and mentally so that viable candidates for any cure research and treatments that may come about in the future, while remaining committed to their current needs. Yes, research will drive this field forward, and rehabilitation will keep it grounded in reality. Let me end by saying that this is truly an exciting time to be in the field of spinal cord injury. The science is advancing rapidly, and we're now witnessing interventions that once felt like distant dreams, and they are becoming possible. I look forward to the next wave of discoveries, to what tomorrow and the days after will bring, in enhancing recovery and restoring function. But as we push the boundaries of what's possible, let us never forget why we do this work, not only to advance science, but to support people in living fully with purpose, connection, and dignity. Thank you very much.